are so difficult to get on, but I think I've made a dress out of it. We're going to interview Dr. Jeff Rozovic today. We're going to get a physical and information on injuries. Should the first thing that a person does, be it that they start training now or they're in training already, is get a physical?
You should get yourself checked to make sure that there are no significant medical problems that you need to deal with prior to undertaking any sort of training.
Such as?
Such as, well, we need to check you for cardiac problems, diabetes, see if you've got any family history of anything that we need to worry about.
What about the back, the spine, joints, and things like that?
Yeah, we would look at all of those things, although most people will come in with certain complaints that we've already annotated. It's the hidden types of things that you've got to worry about with, with cardiac problems and stuff like that.
How much time does it take to get a physical done?
It's about 45 minutes, and then we would do some investigations on your blood work, and if there were any problems with the joints or the spine, we'd get some x-rays taken.
So the key is don't wait until there's something wrong with you. Come before you start the training.
Yeah, absolutely. Unless you've been keeping regular fitness program going and you've had regular checkups with your physician, if this is a one-off thing for you, then you definitely need to be looked at first.
I'm totally all over my schedule. I'm not lying to the camera. So the next thing is, the next big thing with marathon training are injuries. And I wanted to talk to you about cold laser therapy. Tell us what that is. A lot of people don't know.
Cold lasers are what physiotherapists in particular use to help treat injuries. The reason they work is there's a specific wavelength of laser, and they call it a cold laser because it doesn't heat up the tissues. And what it does is it actually opens up the blood vessels and increases the blood flow so that you get more oxygen and more healing factors into the area.
So what are some of the most common injuries that you see in runners and people who are training to do long walks?
They're all overuse injuries, particularly in people just starting out. They overdo it, they don't stretch adequately, so they end up with muscle tears or inflammation of the tendons or inflammation of the ligaments around the knees. You can get lots of these minor soft tissue type of problems that just slow your progress.
What's a good rule of thumb for someone who's beginning the training process, such as I am, in terms of how many hours I should be training per week?
Well, you should probably be training every day, with the exception of 1 or 2 days off, depending upon your program. And generally what you do is you build up a tolerance regime. So if you're trying to build up a running program, you would run for a certain number of minutes and then you'd walk for a certain number of minutes. You'd repeat that on a daily basis, gradually increasing the amount of running and decreasing the amount of walking.
So don't be a hero or attempt to be a hero like some of us and do a 2-3 hour run, the first time out. Start maybe with a 30-minute?
30-minute broken up with walks.
I can totally do this now. What else about cold laser therapy should people know? What does it treat, I guess, is what I'm trying to find out. Is it really good for joints?
Not so good for joints, really good for soft tissue injuries, muscles and ligaments. Joints, that you might get a bit too much stimulation of the joint capsule, which could cause a little bit of pain.
Will that make me run faster?
I could.
Okay, let's do it. Let's start with the physical then.
Okay.
Okay, great. Now, is it important to have your spine checked, obviously, when you're running and walking so much for a marathon?
Well, it's important to get it checked prior to doing anything, just to make sure that you've got no areas that are, abnormally tender. Check the muscles to make sure the muscles are in good shape, that you don't have curvature
A little higher,
on the
doctor.
spine.
A little higher.
This is good.
Oh, this is great. If all physicals could be this easy, wouldn't it be great?
It would be excellent. Yeah.
Why do you think people are so afraid to get physicals done?
In case they find something that they don't want to know.
This is my first time.
Yeah, it's the first time for everything.
So bad. I'm getting a massage.
Okay, so your spine feels good. Now we need to check the rest of you out.
Okay.
So we really need to get the cameras to leave.
Okay. We'll post more information about what we've learned here today about cold laser therapy and getting a physical. Don't forget to follow us on Facebook and Twitter. And of course, you want to sign up for the marathon or be a sponsor. All the information is at surreymarathon.com. Now get out of here. I got to take my clothes off.